I'm Kate King, the Director of Health, Family, and Community Services for Columbus City Schools. I'm here today to talk to you about isolation and quarantine for when we come back to in-person learning. I want to just go over those words which we hear all the time. Isolation is for people who are sick. Sick, isolation. Being sick in this pandemic is having a positive COVID test or having COVID symptoms. People who are sick and are isolated should stay home for 10 days after their first symptom or their test and can come back into society with a mask and social distancing, of course, on that 11th day as long as their symptoms are improving and they don't have a fever. Quarantine, a different thing, however, is for people who are not sick but who have been exposed to someone who is positive for COVID-19. Exposed means that that person was within 6 feet of the positive person for 15 minutes or more cumulative, like adding up for the past 24 hours with or without a mask. That's an exposure. People who are exposed are quarantined, which means they should also go home and stay home and not go anywhere, so that in case they did get the virus from their exposure, they got the transmission and contracted the virus, that they will not transmit it to other people either before they get symptoms or if they're asymptomatic. Now, there was a change at the end of last year, at the end of 2020, in the amount of days to be quarantined. So it used to be that people who were exposed 15 minutes or more within 6 feet of somebody who's positive needed to stay away from the rest of society, the rest of not going to Wendy's, not going to work, not going to school for 14 days. And what we found with research is that we know that most people who are exposed exhibit symptoms within days 1 through 10. Now, there's a very, very small percentage of people who get symptoms day 10 through 14. And because of that research, we know that most likely, if you haven't gotten symptoms in those first 10 days after exposure, you're not going to get symptoms and you don't have the virus. So on day 11, people who are quarantined can come back out into society again, social distancing, mask wearing, all of the things that we normally do, but we presume that you are not contagious with the disease. Now, we're still going to watch for symptoms for that day 10 through 14. So if you are quarantined and come back on day 11, you're still going to want to watch for all of those symptoms: the cough, the headache, the runny nose, the diarrhea, the fatigue, all of those symptoms that are COVID symptoms. So we are going to implement those strategies when students come back to schools for both students and staff members. It's really the same for everyone. We're going to make sure that we identify people who need to be isolated and identify people, students and staff members, who need to be quarantined, and make sure that those things happen as soon as possible so we decrease the transmission of COVID-19 in our schools. Thanks for listening today.